Hi, everybody. My name is Ryan, and this is a presentation on Parkinson's disease. Now, what is Parkinson's disease? I'm sure most of us have heard of it before, but what it is a movement disorder in the body that is connected with our nervous system. And it doesn't really affect everyone in the same way, but what I'm going to be going over is the most common symptoms that do happen when someone is experiencing Parkinson's disease. What is the most common symptoms in Parkinson's disease? It's mostly associated with tremors in the body, also known as like uncontrollable shaking. And this usually happens in the hands, but can happen in other parts of the body, as the arms, the legs, and things like that as well. And because of this constant shaking in the body gets more rigid as well. They feel constant muscle stiffness and soreness due to the constant shaking and tremors of the muscle. This happens because the nervous system in the parts of our brain slowly weakens or damaged or dies over time, causing less bodily control. Thus, by extension of that, bradykinesia does occur. Bradykinesia is, in simple terms, the body's movements are slow. So even automatic or spontaneous movements, things like this, things that can be affected by this is like even daily tasks like doing dishes or putting clothes on can become really frustrating to someone who does have PD. And lastly, another really common symptom of it is the loss of balance or the changes in posture. And this is usually in a negative way and is very, very common when it does come to PD. PD is most commonly seen in elderly patients. This is the second most common degenerative brain disease behind Alzheimer's. And while it is most commonly seen in elderly patients, younger generations can be diagnosed with it, although this is more of a rarity. There currently are no lab tests or blood works that can be done to diagnose PD. Diagnosis usually comes from seeing the symptoms first, and the symptoms that we just gone over, like the tremors, rigidity, and things like that, that is the symptoms that are most common when diagnosing PD. While there are a mountain of other symptoms that are closely related with PD, for example, depression, speech changes, urinary problems, sleep, skin problems, and so on, what we are focusing on today is the movements related the movement relations to PD, i.e., the tremors and things like that we've been going over. So what is it like to have PD? Unfortunately, without the use of expensive equipment, it is hard to replicate the tremors and such, but what you can do to kind of feel what they do go through is take your forearm and flex it as hard as possible and hold that for as long as possible. And you feel that soreness and stiffness that's happening while you're not replicating the shakiness. What you're replicating is the soreness and the rigidity that comes from flexing your forearm for so long. And realize that when you finally relax your arm, because the feeling is just becoming too uncomfortable, please realize that people with PD cannot do this. They have to constantly feel this feeling in their arms. So when they actually do go get treatment or feel and that tremors do stop or at least calm down, it is such a relief for them. So what is treatment exactly? Currently at this time, there is no cure for PD. And while with there is no cure, but there are a plenty of different treatments from physical therapy to injections to deep brain scans, exercise, things like that. Those are the most commonly treated treatments of PD. Exercise is widely regarded as a must. So even if you do physical therapy, injections, or drug treatments, or deep brain stimulation, exercise is a must through every step of the way. Exercise can help keep the body together, strengthening some muscles, and as well as providing more of a link from the brain, from the nervous system to the body. This helps with also with the tremors and muscle stiffness to help provide some comfort. Injections and drug treatments also do help with that stiffness and provide some comfort as well. Some of us may have seen deep brain stimulation on social media, and it's usually of someone with harsh tremors, and we see the before of them seeing those harsh tremors, and then after being treated, they're able to have much more control in their body, and it's a really wonderful thing to see. But the most common thing that people with PD usually go through is physical therapy. I was luckily enough to be at a PT clinic where they did help treat Parkinson's disease. And what they used was LVST big movements. And it is very interesting to watch. It involves making a wide movement to counteract the small shaking movements of the Parkinson's effect. And it is with LVST, it is most commonly and most effective during the early to middle stage of PDs, and it helps further slow those symptoms progressions, and it would be something that I definitely recommend. And some of those motions are taking one big step forward and raising both of your arms at the same time and slowly moving back and forth in that position. And those are like those really big movements. They're whole body movements that occur to really help with those small constrained movements that the body does go through. And then lastly, I want to show you guys a video of someone who goes and does cycling, a very great exercise because it is very big movements, and see for yourself.
I have the good fortune of riding with my husband and several neighbors, and I ride with a new focus in mind, and that's to help relieve the symptoms of Parkinson's disease. I found biking to be so beneficial for me and my Parkinson's symptoms that I want to encourage other people to consider it as a form of exercise. I'm in my 14th year with Parkinson's, and I find the high-intensity riding has helped lessen the symptoms of rigidity and tremor. You can undertake other forms of exercise as well, whether it be swimming, running, walking with your family, friends, grandchildren. Start with a spinning class at a local gym or community center. You'll really find the benefits of exercise.
And she brought up some great points as well. Swimming, another very big movement. Exercise that does really help with that stiffness and rigidity and the tremors that she was talking about. Most of the treatments that you will see with Parkinson's disease does involve big movements to really help stretch out the muscles, instead of doing all these small motions, because like I said before, a lot of the things that PD usually does go through is through the hands, so it's a bunch of smaller movements, and doing those big movements really help counteract that. That being said, thank you very much for listening. Here's some of the references that I use, but other than that, thank you so much, and you guys have a great rest of your day.